Welcome to Cancer Bites, bold voices, big insights, and unstoppable energy, because cancer doesn't get the last word.
Welcome everyone to another episode of Cancer Bites, and this is going to be one of our great empowering conversations. My name is Stacey Alvarez de la Campa, and we're getting into a topic that we like to say goes beyond the pink ribbon. October is Breast Cancer Awareness Month, and we feel really honored and truly just so happy to be able to welcome Dr. Brandon Richland with us. He is a board certified plastic surgeon, and he's known for helping women feel whole again. There's the holistic side of recovering and dealing with the breast cancer surgery and reconstruction, and I think that's something that makes his presence here really special. There is a focus on not just the outer but also the inner, and we would love to hear from him about what it means to heal. And before that, we're gonna get right into bringing in our founder of Cancer Bites, Siobhan Shaw. Siobhan, hey there, how are you?
Stacey, I'm so excited for this because I think that a lot of women go through mastectomies. I luckily, everybody will hate me. I luckily I'm not one of those women. For some reason, I guess they just think that the drugs will take care of whatever is in my breast, and I'm lucky. So, but I'm, Dr. Richland, you might see me for a little nip and tuck or a little lift as I get older. You never know, but I'm going through breast cancer right now, and it's not what I expected. But I've taken the initial shock and pain and turned it into purpose and turned it into Cancer Bites. And Stacey has illuminated the show. She's an amazing host. And if I was the host, I'd just be talking about myself all the time. So she's going to take the reins here. And I just want to welcome you, Dr. Richland, to Cancer Bites. And we appreciate the time and energy that you will put into this podcast. And you never know, I'm not too far away from you in California. So you never know, there might be a call or a knock on the door going, hey, remember me?
Absolutely. Well, yeah, thank you so much for the introduction. Happy if you're ever in town, come see me, come visit, say hi. Happy to help out where I can. But yeah, it's an honor to be here and, speaking, about breast cancer and Breast Cancer Awareness Month.
Thank you so much. Thank you so much. I mean, I'll introduce you a bit more. I did mention that you were a board certified plastic surgeon, but I also want to say that you do have a very modern and I think up to date holistic approach to helping patients. You're based in Newport Beach and Huntington Beach. I was talking before the show aired that I can't wait to go out there and try to surf. I'm based in Barbados, so someday I'll be knocking on your door too to try surfing. But we know that you are well known for your meticulous attention to detail and your commitment to patient care. So you've also said that nothing makes me happier than transforming my patients' lives by empowering each to live the life they've always wanted. You're a graduate of UCLA and St. Louis University School of Medicine, and you have earned top honors throughout your career, including the prestigious Top Surgery Student Award. So we are really blessed to have you with us. So we're gonna start off by just, we'd love to hear from you. What inspired you to focus on this particular niche of surgery of breast reconstruction?
So I've always loved surgery, and I feel like plastic surgery in general allows you to be very creative. And so that's why it stood out to me over other surgical specialties. Specifically with breast cancer, what's so neat about it is you're not only combining just, the reconstructive and plastic surgery portion, but it's really a journey for these patients. And as patients who are either survivors of cancer or who have gone through it, it's, the diagnosis and the treatment is only the beginning. And especially for something like breast cancer, where, the cancer can be treated. And, that's always the number one thing, right? Treat the cancer, beat the cancer. But then, there can be sometimes the fallout of these life-saving treatments, radiation, chemo, mastectomies. How do we make the woman feel whole again? How do we make her feel happy in her body again now that she has beaten the cancer? And so that's what's really drawn me to particularly this field as well.
That's fantastic. And you mentioned two things. You mentioned the healing part that's both physical and emotional. So it sounds as
Mhm.
if there's some definite emotional and psychological impacts of the reconstructive surgery. Can you tell us a little bit more about that?
Yeah, absolutely. And so, what I commonly see in my patients is that, like you said, it's emotional, and it's physical. And sometimes they're both combined together, where almost that physical scar, that physical deformity, that physical appearance they may see in the mirror where they're not whole,
Mm.
that almost makes the psychological aspect worse, or sort of hang on to that longer. So that kind of goes hand in hand, right? Healing from the cancer, beating the cancer, and then restoring your sense of wholeness and self again.
Yeah, and I mean, I can bring in Siobhan here just to say, Siobhan, whether there's reconstructive surgery or not, they are definitely two aspects of cancer. There is the physical and the emotional and
Mm.
psychological. Siobhan, I'm sure you can give us some insights about that as well.
Well, over and above the shock of being
Yeah.
diagnosed with metastatic breast cancer, and for the women that lose their breasts, I just can't imagine that what they're going through, because they for me, I mean, there's pain anyway, and there's other aspects to breast cancer. For mine, it was my lung is filled with body fluid, and
Mhm.
I've had to go through 16, 17 thoracentesis to reduce that, and then the drugs are kicking in. I take chemo pills as opposed to going to do the IV, and I feel great actually. I'm really surprised about that, but I won't have those lasting scars, and and the choice of, do you want breast reconstruction surgery, or are you at a stage in your life where you don't care, or when you look in the mirror, I can't imagine what it would be like to see the scars of a mastectomy. I mean, I thought they would definitely take my breasts off,
Yeah,
but they're
yeah,
not.
yeah,
And I don't know
yeah.
if it's my age or my level of seriousness of the cancer, right? They're just like, because they said I had 6 years left to live, but I feel like I have 66 years left to live after 4 months in treatment. So
That's,
um, it's probably everything to do with Stacey and Cancer Bites and the energy that
oh,
comes from this show and the community. But it's got to be hard. It's got to be frustrating. It's what do you find that most of your patients say? Like, are they just scared? Are they get my boobs back? Are they in that frame of mind where they just like fix me?
mm,
Yeah, absolutely. And thank you so much for sharing, about your journey and diagnosis. That's such a difficult thing to go through. My father had a very late stage metastatic cancer diagnosis just about
mm,
2 years ago,
mm,
pancreatic cancer, which survival rates of, less than 1%. So, that's sort of how that ended up. But it's a
Mhm.
very difficult
so
thing,
sorry.
going through that. So thank you for sharing that, and kind of tying it back in.
Mm,
But yeah, to answer your question, so it's sort of interesting. I see, again, I keep mentioning the word journey because it really is, and I
yeah.
see women at all stages along the journey. And so, women initially when they get that diagnosis is exactly as you talked about. It's the shock, the fear, the concern, the unknown, can be overwhelming, all of these emotions. And, so my job is to, help comfort, to inform, to develop treatment plans. Fortunately, technology's evolved, chemotherapies evolved, treatments have evolved. So,
Mm,
so the survival rates, I mean, we're seeing significantly higher, from even just year to year or decade to decade. The chemotherapy and these life-saving treatments are just, better than they've ever been, at any point in our lives, or, at any point at all. Um, but yeah, so I see women at different points at their stage, and beginning stage is sort of that fear and concern, and then as they're preparing for surgery or their treatments, right? It's kind of getting them into the mindset of prepping them, giving them the information, having them have a positive mindset to help beat that cancer. Once the cancer is gone, it's, how to reconstruct that self again. And that's sort of the process. It's a whole journey, but that's kind of how I break down the process. Unfortunately, sometimes reconstruction doesn't need to wait till the very end. So there's sort of 2 points at which you can do reconstruction. One is immediate, and then one is delayed. So you have immediate breast reconstruction and delayed. And with immediate breast reconstruction, that means at the time of the mastectomy, so at the time that breast is being removed, I can do the reconstruction. That's about how it's done, I'd say, in my practice, 80–90% of the time. It's just, it's generally less surgeries, kind of, at least the woman has something there. So yes, there's scars, but they're not completely flat. And it does make the reconstructive outcome better. Delayed would be, maybe for someone who isn't sure about reconstruction, maybe they're really sick, maybe they have multiple medical comorbidities, and they're not a great surgical candidate. But it doesn't mean that it couldn't be done later.
That's great. And it sounds as if, that positivity and that hope, but also that clarity about exactly what the options are, I think are really helpful to women. And it sounds from what you're saying as if there have been some specific advances in reconstruction techniques that in your field, you would know about. Are there any specific ones that you think you'd like to share and what women should know today?
Yeah, absolutely. So as far as reconstruction, like I said, you have immediate and delayed reconstruction as far as timing. There's two major different reconstructive techniques. One is to use some sort of implant. We call that implant-based reconstruction, whether it's an implant or tissue expander. Or you have autologous reconstruction, which is using the woman's own natural tissue. It sort of depends on patient factors and the stage of the cancer, how much of the breast is being removed. Generally, though, the majority of breast reconstruction is doing some sort of implant-based reconstruction. It's a little quicker, it's easier recovery, in and out. It can be done same day, or even, the patient stays just one night overnight, and you don't have the extra donor site, the extra scars from removing that tissue. But some patients who maybe have more severe radiation, chemotherapy, thin tissues, they may be a candidate for using their own tissue.
Okay, that's really, like, it's so comprehensive, and as I said, it's so clear that you're explaining this so that we can all understand. And I think it sounds as if it's very important for women to make a decision that feels authentic to them. Would you say that, every case is different in terms of what you would recommend?
Absolutely. And that's one of the things that I do enjoy a little bit about, reconstruction in general, but also breast reconstruction, is really making the connection with the patient, listening to them and understanding what their goals are. And there are so many options, and so many different timings and so many different treatments and so many different type of implants. So we really try and, and there's the option to save the nipple or not save the nipple. And then, where do we place the incision? Do we use alloderm, which is sort of a mesh or sling to hold the implant in? Do we, wrap around the front? Do we put in the back? Do we put in the bottom? So there's all these different techniques that we can use. And so in the discussion with the patient, we try to figure out what's the best for them, not only at that point, but long-term, and then we tailor, I tailor the surgical plan to the patient.
That's absolutely fantastic. And it sounds also again that, that connection of a woman's identity and who she is, that's one of the reasons, I guess, it's really important for there to be that specific level of attention, and you tailor it specifically to what women need, and also, what they've discussed with you. And I think, the idea of empowerment in this recovery, I think it sounds like it's really important, and you're aware that your role is to facilitate that to an extent. So, I was thinking of another question. I wondered, do you ever, encounter when you're doing the normal preliminary checks, if someone's maybe just coming in to have a breast lift or a breast reduction, have you encountered, cancer that someone didn't know they had when they've come in for the procedure?
Yeah, so that's a great question. And to answer, yes, I have.
Mm.
And that's why it's important to do a really thorough examination on every patient and make
Mhm.
sure you get the proper preoperative tests. So,
Yeah, yeah.
recent story, a patient was coming in just for a routine breast lift. I do my physical examination. I didn't feel any masses, and she had never
Mhm.
felt any masses.
Mhm.
But what I do require is any patients who are above the age of 35 that they have a
Mhm.
mammogram that's done in at least the past year.
Wow.
And she was, I think, early 40s,
Yeah.
had actually never had a mammogram. She got her
Yeah.
first mammogram. There was a small mass there.
Wow.
A couple weeks later, it was a biopsy, and it was actually shown to be breast cancer. And
Yeah.
fortunately, it was stage 1 very early. They just did a
Yeah.
lumpectomy and some radiation, but
Yeah.
and she's doing great now. But almost we caught it basically because she'd
Yeah.
come in for
Oh
the
my goodness.
cosmetic surgery. So who knows,
Yeah.
what point it would have been caught otherwise. But yeah, that absolutely does happen.
That's incredible, and it shows the importance to women above a certain age just of getting checked. And I do admire your pre-op procedure. That it is something that you insist upon, that there should be a mammogram above a certain age. So I mean, I mean, I could go on talking forever. Like time is running out, but we do have some just some other, we like to call them like bite-sized nibbles. We say cancer bite, but we like to sum up the show with just some little thoughts. So
Okay.
what gives you joy outside of surgery? What would you say you enjoy doing outside of surgery?
I really love, so a couple things, if I can
Hmm.
choose more than one, get
Yes,
a
of
couple
course.
nibbles here.
Yeah.
Um, spending time with my family. I have a beautiful wife, a beautiful son who's 2.5 years old,
Aw.
two beautiful dogs. So, um, you know, being a physician is, one of my loves, but also, my family as well. Definitely make time for them. Um,
Yeah.
we do little dog walks
Yeah.
together, things like that. We go to the park, so that's always nice. And then, I do enjoy traveling, and
Oh,
I
lovely.
love scuba diving, and I
Oh.
love skiing. So those are two of my favorite sort of activities as well.
Well, awesome. And another one of our small bites. Do you have a quote or a phrase or a philosophy that guides your work? You mentioned creativity before. Anything else you think is part and parcel of your work?
Yeah, so definitely creativity. And I think we've mentioned this a little bit, but trying to tailor the surgery to each
Yeah.
patient and individualize the treatment. I think
Yeah.
that's so important. And
Mhm.
I'm fortunate to work with some really fantastic breast cancer surgeons, a fantastic breast cancer team, oncology team, radiation oncology, and they're just a really great team. And so, together, I'm sure you guys know that there's, tumor boards that we go to and discuss the patients,
Yeah.
to individualize, each patient's treatment.
Oh, yes, that's great. And, as you were talking, it came to mind to me that, your treatment and being under your care, it's almost a way that women they can find your identity and find part of who you are again, because you tailor the treatment so specifically, which I think is wonderful. And, one final question from us is, what's like one thing you wish every woman facing Reconstruction knew ahead of time? What would you like to let them know?
I think that one thing they should know is that there's always hope and there's always
Right.
options for them.
Yeah.
Um, fortunately, I've had fantastic training. I've been treating hundreds, if not thousands of patients now. And so I've
Yeah.
seen, there's always gonna be something new to see, but I've seen a lot. And some women come to me with no hope, like, can you do anything for
Oh,
this? Or,
yeah.
this breast has been gone for 5 years, and they're like, you're the last surgeon I saw, right? And so there's always hope. There's always things that we can do, to at least recreate a breast mount, recreate the nipple, recreate some volume, increase symmetry.
Yeah.
And yeah, so there's always hope, and there's always someone out there willing to help.
Oh, that is wonderful. I mean, so before I turn it over to Siobhan to close, I want to encourage everyone watching, please follow Dr. Richland on Instagram. He's at dr.richland and then also at Richland Aesthetics. And you can learn more at richlandmd.com. And this has been an amazing conversation, Dr. Richland. Thank you so much. And I'll turn you over to Siobhan, who will close things up for us. Over to you,
Thank you.
Siobhan. Mhm.
I think it's great to learn all that, and especially to learn that you've caught cancer, breast cancer early on in some of your patients that are just coming in for the cosmetic surgery. Cosmetic surgery gets a little bit of a bad rap sometimes, right? I think that they have to take that into account, that sometimes women will not go to the doctor, but they'll go to their cosmetic surgeon. And you are there to save their lives. And I think that that is a part of the story nobody's ever asked. So good on you, Stacey. And I just want to mention ways to support Cancer Bites to our audience. And we've got the holidays coming up. So we've got a holiday gift bag campaign where we're filling gift bags with amazing little things from some of our sponsors. And one is Gleam Beauty and Skincare. And the CEO herself is a breast cancer survivor. So Marlene Wallach will be on the show on 11/11. I just can look at my board over here. But we can't wait to speak to her. And then, of course, Simon and Schuster, Brazel. These are some of the things you should have in your office, actually, for your patients. They're really cute little curly cues that keep your bra strap and your thin strap dress together.
Wow.
But we
We're gonna
have
have to-
amazing. I know you want some.
We'll
We're gonna have to
definitely
try
send you.
those out. Yeah.
Yeah.
Yeah,
That
absolutely.
looks great.
I'll get Jenny to send you some. So we have like just amazing people that are jumping in and helping because they want to do good, and they see that women with breast cancer, you know, yes, your medical might be paid, maybe not all of it. You might not be on the best treatment for your cancer because your medical won't pay for it, you know, the insurance won't pay for it, and you have to go through some really rough spots. But there's one thing that is missing from the whole process is the self-care, going to get your nails and your hair done and a massage and, you know, a pedicure. Those are things that you don't necessarily have the energy for anymore. So if we can bring something to somebody who's suffering, who is on their own, maybe for Christmas, we will do that. What we also are doing, which is very exciting, is we're putting together a gift guide for the holidays and probably one for the new year, because we have so many people sending us ideas and we have some amazing people. So we want you to watch on our YouTube channel, start to watch for our gratitude spotlight, as well as our full episode shows like this one with Dr. Richland. And if you missed last week, you got to check it out. The 9/11 first responders and their lawyer, Michael Barash, they were there to talk about the tragedy at the World Trade Center and how Michael represents 73 men with breast cancer. Dr. Richland, do you find, I never asked you this question, do you find men come in to see you for some sort of reconstruction?
So male breast cancer is definitely, it happens, right? It's a real diagnosis. Some men develop breast cancer because some men do have breast tissue. Incidence is much rarer than females, but we do see it. Now, fortunately for men, it's more of a social standard for a man to have a flat chest.
Yeah.
So the deformity left behind isn't as severe, but you can't imagine if it's too flat like a board, it's doesn't look quite right. So there is reconstruction that can be had with sort of pectoral implants, fat grafting, tissue flaps, things like that.
That's a great thing to know, because I hadn't thought of the guys while we were preparing for this show, and I'm glad I brought up our 9/11 guys that were on the show last week. Stacey?
Yeah, so I want to say again, thank you so much, Dr. Richland. And I think our key takeaway here is that the idea of reconstruction, it's not just vanity and it's not just physical. It does help a level of healing that really can bring quality of life. And we want to thank you so much for, you know, showing us that it is indeed a journey, and a journey that's different for every woman, and a journey that can lead to empowerment. So thank you so much for taking the time to join us. And you know, you're always welcome to come to Barbados and scuba dive. It's a great place for families and kids, Dr. Richland. So, you know, I'm here, and anytime, seriously, please reach out to us. We're
Well,
so happy to have you. Thank you.
And
thank-
Dr. Richland, you're the first doctor I'm coming to if I want to have a breast lift.
Yeah.
I don't know any others, so I don't have any favorites, but now I do.
Well, thank you so much, both of you. I really appreciate that. Appreciate you having me on. This is just, you know, the breast cancer awareness month and breast cancer. It's definitely something that, you know, I think is very important. You know, in spreading the word, like you said, about the journeys and, you know, like you said, it's not just vanity. It's the physical and psychological aspect of that as well. So, and just watch out. I may take you up on the Barbados offer.
Seriously,
So.
great place to
I
come.
may see you there
You
soon.
have my contact, no problem. Thanks so much to everyone, and we will tune out, and we'll see you again next week.